Hey guys, this is Dr. Ashley from Head to Toe, and today I wanted to talk about a couple of quick fixes for those of you who have more low back pain in the evenings or more towards the end of the day. When I see cases like this, I'm thinking more of, okay, you probably had yourself in a poor posture throughout the day, which is causing the muscles, the discs, all those structures in your lumbar spine to weaken and kind of stretch out. So I'm going to show you what's called a seated plank, and this is something that you would do at home. Doesn't matter how often you do it, it's actually better if you do it more often, and it's a static position that you'll hold for about 10 seconds. So what you're going to do is you're going to find a stool, a chair, it really doesn't matter. You can scoot forward in your office chair so that your butt is at the edge. You're going to make sure your feet are flat and that your knees are hip distance apart and in line with your hips, okay? So from here, you want to find your neutral spine, your neutral pelvis. You want to make sure that you aren't rounding at your back. You also want to make sure that you aren't extending too much. So we're going to find that happy medium. From there, you're going to create a brace in your core. So you're going to take a deep breath in. You're going to let it out. You're going to bring those ribs down. Keep those together, squeeze together, and you're going to maintain that brace. From there, you're going to place your hands flat on your thighs, and you're going to push down towards the ground. You're going to push down towards the ground. You're going to maintain your breathing, and you're going to hold for 10 seconds. Okay, so after you've done a 10-second hold, you should feel your core turn on, you should feel your glutes turn on, and you should feel your spine lengthen. As you push, I just want you to think lengthening the spine. Imagine there is a wire connected to your head, connected to the ceiling, pulling you straight up. I want you to lengthen through the spine right here. Kind of get yourself in this neutral posture, especially at the end of the day. Go through it about 3 times and see how you feel. If that's not working for you, if that's not cutting it and you're still getting some low back pain, try this. You're gonna hop off the chair. You're gonna lay flat on your stomach. And we're gonna do some back bends. Now, these back bends are gonna help to decompress the discs in your lumbar spine. Okay, so you're gonna lay flat on your stomach and you're basically gonna seal up. You're gonna press up, get your upper body off the floor, keep your hips down as far as you can. You're gonna let your hips sink, hold here for a couple seconds. You're gonna go back down. We're gonna pair our breath with this. So before you push up, you're gonna take a deep breath in. And as you press up, you're gonna breathe out. Get those elbows to extend and lock out. Drop those hips. And repeat. Normally when I have patients do this, we'll do about 20 reps at a time. See how you feel. After 20 reps, walk around. And I'll have a patient go in between back bends and the seated plank. So go ahead and give those a try if you have PM, later in the day, low back pain. Again, if none of that is working for you, give us a call at the clinic so that we can get you checked out. Thanks.